Hello, and welcome to the Business of Happiness. This is your host, Dr. Tarryn MacCarthy, and you have just stumbled upon the very first episode in the CALM Clinician Series. Ta-da! You're in the right place if you are looking for calm. If you have been noticing stress and overwhelm and burnout and anxiety and just feeling exhausted, well, you're in the right place. You're in the right place because in the CALM Clinician Series, my intention over the next several episodes is really to invite you back to the practices of how to find yourself, how to find your calm, how to refuel, how to realign with that incredible power that is within you without the stress and anxiety every single day as a doctor, a dentist, a leader, a practitioner, a clinician, and to give you back your freedom, give you back your sense of calm. So welcome. I'm really excited about this series, actually. It's been something I've been putting together for quite some time now. And this first episode is all about finding stability amongst other people's anxiety and stress. That's what is such a critical skill to learn in healthcare. As a practitioner, as a clinician, it is so important for us to learn how to not attach to other people's anxiety. So it's so interesting because just in the past week, I've had two beautiful examples of this that I'm going to share with you. One in practice, in dentistry, and one in private life. So really, these skills that I'm going to be sharing with you over the next several weeks are absolutely applicable to all components of your life. But you know, it's so interesting. I'm going to tell you these two stories. It's so cool how the universe always brings us exactly what we need. And as I was planning this beautiful series for you, wouldn't you know, the universe gave me two beautiful examples of how we sometimes let other people's anxiety become our own. Isn't that so fascinating? So the first story is about my own personal life. So as many of you know, I have teenagers, and I was visiting a few colleges with my son and my husband and my daughter, and we were traveling. Actually, we went to California, which was so cool. Everyone who's listening to this podcast who's from California, I love your state. I had such a wonderful time. Your weather was spectacular, and it was gorgeous. We had the pleasure of exploring the coastline, and it's just so spectacular. So thank you for that opportunity. But we were looking at many colleges over a few short days. And this has really been the first time that my son has been exploring schools. We've seen a couple on the East Coast, but this was our intentional trip for college exploring. And I think it was about the third or fourth day. We were stopping between colleges, between, what are they called? Tours, invited students visiting tours, and between two different schools. And we were trying to find a place for lunch. We were in a neighborhood we'd never been in California, and we were trying to find something healthy and delicious to eat. We got into the biggest fight between my husband, my daughter, my son, and I. It was all over food. It was about lunch, where to eat. And what I noticed was that my body was beginning to feel stressed as well. And I was digging my heels into finding something healthy. I wanted some good ambiance so that we could sit and chat about the school we'd just seen. I had a very clear idea in my own head of what lunch looked like to me. And my son was so adamant that he knew exactly what he wanted for lunch. He kept insisting on Chipotle, and Chipotle was not in my vision. So he was so adamant. Everything he was turning down, all the options and choices that I was finding, he was turning down. I was looking for all kinds of restaurants that might give him exactly what Chipotle had to offer. My husband started getting angry and frustrated because my son was being difficult, and it turned into a big fight right on the sidewalk in the middle of this town, in the middle of California. And to the point where someone actually came out of the restaurant we were standing in front of and said, "Hey guys, it sounds like you need some suggestions on where to go for lunch." And she gave us some great suggestions, which was really sweet of her. But oh my gosh, was it mortifying to all of us, because it was very clear in that moment that we were having a vocal argument about where to eat, to the point where other people were noticing. And what's so interesting is I took a big step back. I think we all did in that moment, the moment that woman walked out of the store. And I realized, wow, I wasn't feeling stressed out before we were looking for lunch. I was loving that tour. I really enjoyed seeing the college we'd just seen. I'm on vacation. I'm in this beautiful state, enjoying this wonderful time with my family. Why did I get riled up so quickly? Why did my own stress and anxiety kick in when there was nothing to be stressed about? Literally nothing to be stressed about. And I realized that I had allowed my son's anxiety to rub off on me. His stress and overwhelm became mine. Isn't that interesting? When I went up to the 50,000-foot spot of observation, pulled myself up out of the situation and looked from above, I realized, oh, wow, we're visiting these schools. It's provoking some anxiety and stress in him. And whenever he feels stressed out, he starts trying to control. And so for him, the way he was in his little 17-year-old mind, the way he was trying to control his stress and anxiety was by trying to control where we were eating. And that fear and stress I had allowed to become mine. Isn't that interesting? I realized in that moment that I had let myself take on his stress. It was also so interesting because we came back from California and my husband had to see a patient of his who had gone into the hospital while we were away. And she had gotten worse. I can't remember the details of the treatment. I can't remember exactly what had happened, but this poor woman has a major lesion in her jaw that needs to be resected. She has cancer. She's not very old. She's kind of in her midlife, and she needs to have a very large piece of her jaw removed. And so she was being seen in the hospital while he was gone. One of his partners was seeing her. And when we got back, he said, "You know what? I'm just going to go see her. I'm not working today. It's a Sunday, but because I feel like this is probably a big deal for her and the whole team at the hospital wants to know that she's being taken care of, I'm just going to go check in on her." Such a great, excellent pro move. Well, he went and he called me from the car on the way home. I said, "How did it go? How's she doing?" He said, "Tarryn, she is the nastiest patient. She is aggressive. She is mean. She was blameful. She is not fun to take care of. And I'm feeling so worked up right now because I was just going out of the goodness of my heart and she just made me feel so bad. And I'm so stressed out right now." Right there was another beautiful example of how he was allowing somebody else's stress and anxiety to rub off on him. Before he left, he was also feeling great. We just came back from this gorgeous vacation. We had a beautiful, leisurely Sunday morning. Everything was so good. He was tapping into that beautiful part of himself that was caring and loving and wanting to see this patient and just make her feel good and protected and safe and taken care of. And immediately, her stress and anxiety rubbed right off on him. And how easy it is for us to go to blame. How easy it is to rather blame her, just like I was blaming my son. Immediately we start to blame because blame feels so much better than feeling the stress and anxiety ourselves, than recognizing that within ourselves. It feels so much better to blame someone else. Isn't that true? And what we can identify in that moment is it's fight or flight. And when we blame, we're choosing fight. And it's not always a choice. It's definitely not a conscious choice. It's something that happens right in our amygdala, right? That goes right through our adrenals first. Our body is immediately in fight or flight when we perceive somebody else as aggressive or attacking. Our bodies go into fight or flight. And that is how we allow somebody else's anxiety to become our own. It makes so much sense that this poor woman is aggressive. She doesn't have the tools to deal with her own stresses either. She is in a place of fight or flight herself. Her anxiety around the cancer in her face. It makes so much sense. I would feel so stressed out myself if I was lying in a hospital without a planned surgery, waiting for the hospital to give me a time and date for my surgery, and knowing that there was cancer in my jaw. And obviously she's sick enough that she needs to be in a hospital setting, missing out on her family on the 4th of July weekend. And of course, it makes so much sense. So isn't it so fascinating how often we allow other people's anxiety to become our own? And there's so many reasons for it. Number one, it's just energetically siphoning off on us. You know that feeling when you walk into a room and you can just tell somebody's energy. When somebody's in an anxious, stressed out, overwhelmed, or even angry place, that energy can impact us, right? We can just feel that in the room. And so energetically, that starts to rub off on us if we don't protect ourselves, if we're not aware. And the second component is we make it mean something about us, right? In that example of me with my son, when he was beginning to argue with me about lunch, I know that the fearful thought that I was thinking is, oh my gosh, I've raised this entitled kid. I've flown him all the way to California. I'm taking this whole week off just for him. And now he's arguing with me about where we're going to eat. That fear, that meaning I made about me, that I was a bad parent, that I'd done something wrong in raising him. So fascinating. So instantly we make it mean something about us. Maybe my husband made it mean something about him as a clinician, as a provider, as an oral surgeon, when that patient started becoming aggressive in the hospital. So the other thing that we sometimes do is we allow our bodies to become stressed out to match their stress level. We mirror. And that's what often happens when we're not aware. What's so cool as practitioners is we actually have the opportunity to influence other people. We actually have this, and you know from your experience working with patients and with your team, when you've been able to actually bring calm to the room. But what it requires is first having the awareness that you're jacked up, right? We can't reach for calm or give someone else calm when we're in a place of stress. So important is this first component, which is awareness. And over the next upcoming weeks, I'm going to be sharing with you a really cool practice that I call PAUSE. And PAUSE is an acronym, and I'm going to start unpacking it for you over the next few weeks. And just for this week, I'd love for you to start noticing in your own world, where are you allowing other people's anxiety to become your own? Just that simple awareness, because so often it's not ours. It's not ours. So can you choose today to, number one, become aware when you're allowing that to happen, and number two, no longer tolerating it, no longer tolerating other people's anxiety becoming your own. This happens often in families. So often in families. You know exactly what I'm talking about, where you pick up the phone, it's your mom, and she's like, oh my gosh, your sister did this, and I'm so worried about her, and she's now making the worst decision of her life, right? And then you bring that to your husband, and you go, oh my gosh, let me tell you what my sister's doing. We create a world of stress and anxiety that actually didn't start with us, actually belonged to somebody else. So in this upcoming week, before our next episode, I invite you to just pay attention. Just notice. Can you identify any moment in your practice at work, maybe with your team, maybe a stressful thing that your team is bringing to you, that they feel that someone on your team has created stress and anxiety over or overwhelm that you're taking on, when really you're feeling quite calm about it? Or maybe it's with a patient, which, by the way, happens all the time, because I think it's safe to assume that most of your patients are coming with some amount of stress, especially in dentistry. I mean, they're literally opening their mouths and being so vulnerable. For them not to have a little bit of white coat syndrome is exceptional. So just allow for that everyone's going to come with a certain amount of stress and anxiety. And are you allowing their stress and anxiety to become your own? When you might actually have been calm or present or just been comfortable or safe or just enjoying your day, and somebody else set you off because of their anxieties that aren't your own. Next week, we're going to be sharing with you these really cool practices and how to use pause, this really great 5-step, easy practice when you notice, when you're allowing other people's anxiety to become your own. So, if you don't already subscribe to this program, you're going to want to, because this is going to not only let you know when the next episode is available, but it's going to actually download for you so that if you have some time over the next few weeks, you're going to be able to listen to these episodes. And each of them are going to be around the CALM clinician and how to use this practice of pause intentionally. Super easy to learn. But as I said, over the next week, you're just going to start noticing, which first of all is going to be enormous knowledge for you, because when we know something about ourselves, we have greater insight, we can actually do something about it. So wouldn't it be fascinating? Wouldn't this be so fascinating if you recognize that 90% of your stress is not yours? It's somebody else's that you've taken on? How freeing would that be? How amazing would it be if by the end of this week you realize, wait a minute, most of the stress that I have is not my stress. It's somebody else's stress that I've just taken on. So just pay attention this week. Just pay attention and be sure to subscribe to this podcast so that you can get the next few episodes in this CALM Clinician series. It's going to be amazing, and you're going to be so thankful that you did. And until next time, remember, when you feel good, that's when you can do good. Now, over the next few episodes, we're going to find out, how do we get to the feel-good part? Have a great week, my friends. Hey, beauty, if you enjoyed this episode, then like and subscribe to the show and receive this beautiful message of empowerment, remembering what you are capable of and the purpose you serve in this world every single week. And if you know of a colleague who needs this message, share this episode with her. This is how we raise the collective in healthcare, reminding one another and supporting one another. Community is the answer. This is how we grow it. And lastly, I invite you to a phenomenal in-person event this October 2024, the Empower Her Retreat, exclusively for women in medicine and dentistry, on the beach. It will change your life. And I cannot wait to see you there. Check out the details in the show notes and have a phenomenal day remembering that you are enough.